Welcome back to Beauty Babble. I'm your host, Suzanne. Today we're joined by Marilyn Sepe, all the way from the heart of Toronto, Canada. Marilyn is a leading voice in oncology aesthetics, blending science, skill, and compassion to support those navigating cancer care. Marilyn, we're so happy to have you here. I'd love for you to start with your story. What inspired you to dedicate your work to oncology aesthetics?
Thank you, Suzanne. It's a pleasure to being here with you. What inspired my oncology journey is the fact that I was diagnosed with cancer not too long ago in 2024. I was diagnosed with triple negative cancer, and that's where my oncology journey started.
But you're from our industry. You're in our industry, right? And then,
Yeah.
so when you were diagnosed and you shared with me your stories, many of them where you tried to carry on and
Mhm.
for yourself and have services and things like that, and then you discovered the shift that you're of why you've created this whole thing. But can you share a little bit about how you went from that survivor to, or even through the treatments maybe, and then now you're educating? But let's start with the beginning. You were looking for services, just having facials and manicures and pedicures and
Yes, correct.
all those things.
As you said, I have been in the industry for over 25 years, and unfortunately, I never noticed that there was this gap until I became a cancer patient looking to have services as I
Okay.
normally would. And during that period of time, while I was looking, I noticed that the estheticians were very, very fearful of working on me. And they were
And what was
nervous.
that? I know you and I kind of chatted about it, but what was it that they were fearful? Was it the fact they thought they would hurt you, or was it lack of knowledge, or was it just overall safety? Like, what do you think it was?
All of the above. When you're not educated in a certain situation, you become very insecure. You don't know what to do. You're fearful, and fear is the biggest thing that prevents us from doing a lot of those things. So yes, the esthetician was absolutely fearful, and I ended up in a very high end uh, aesthetics department of one of the main beauty. Uh, oh my goodness, I'm lost for
What,
word.
that's okay. One of the beauty places in that is
Yeah, I
high
went
end,
to
like a lot of
yeah,
people go
high end,
to.
all ran
Yeah.
through, all ran through, and I won't say which one, but it was an all ran through, and I went, and unfortunately, the young lady, as soon as I told her, she was taking my medical history, and as soon as I said I'm a cancer survivor, and I just finished, I think I had finished like a month prior to that, she dropped her pen. And I said, "Oh, you seem to be nervous." She says, "Yeah, I really never worked on a cancer patient before. I'm really sorry. I don't know what to do for you." And I'm thinking, okay, at least you're honest. So why don't I guide you through my treatment? And that's exactly what I had to do. I had to guide her through my treatment. And,
Yeah.
and I told her, this is what you do, this is what you don't do. And, the skin becomes very sensitive, very dry. And, there are a
Mhm.
lot of things that happen um, to the skin during cancer treatments. So I kind of had to teach her in that hour that I was there. I taught her how to do a facial on an oncology patient.
And were
So
you said you finished the treatments, so
I
you didn't go for service while in treatment. You went after treatment.
I had just finished my
Okay.
chemotherapy, and it had been a month, and I noticed that my skin had changed tremendously. It was so
Yeah.
dry, and I didn't like the way I looked. So I thought, let me just go and get a facial. And my daughter was nice enough to send me. She says, "Mom, you got to go here. They're the best." Whatever. I said, okay,
Hmm.
I'll go.
And treat yourself, right? And that's what it's all
And treat
about.
myself because
Yeah.
it was long overdue. So, and
Was it
unfortunately,
sorry, I was just going to ask, is there like normally what happens, and I feel in our industry is that because it's out of our scope of practice in many ways, right?
yes.
That that's what we lean on and say, well, have you talked to your oncologist? Or if it's a skin thing, talk to your dermatologist. Like we're always sending on the medical side of things. Was that ever brought up, or
No,
it was just complete like drop the
she
pen and I
was
don't.
totally,
Mm.
I guess lacking the experience. She hasn't been in the industry for that long, so I
Mhm.
picked that up from her.
Okay.
Um, just not knowing,
Hmm.
she just didn't know.
Which
She was
is
not aware.
fair. It's fair because it's not taught
It
in
isn't.
the aesthetics world unless you're taking it. I feel like there are some oncology programs in North America, Europe, all over the place, but um, it's usually after you've taken your foundational level programs, right? That you're learning and go, oh, I'm lacking this. I really should take that because, as we know, cancer is hitting more and more percentage of people, and
Two
it's
out of every five.
2 out of every 5. Yeah.
Those are the statistics, which I just got a week ago.
Okay. And is that in North America? Is anything
In
specific?
Canada.
Canada alone. Okay. That's interesting.
Yep.
Um,
Yep. There's a
so
lot of us out there.
your experience shaped how you viewed the aesthetics caring and healing side, because that's actually most of the time why we got into this industry, right? Was about helping people, caring for people. And then you
Yes.
saw that gap that's missing a bit, right? And I won't say for everyone, but a lot of us out there, right? So take us to the moment when you shifted and thought, when the little, ding went off in your
Light
brain.
bulb moment came.
Yeah.
Yeah.
And
After
that was that
after I tried,
transformation to educator because you got a taste of it in the treatment while you had your own
yeah,
facial.
I mean, and in the past I taught medical aesthetics, but it was always a superficial thing. It
Explain
but
that,
the skin and that's it. But there's
but
when
not
you
the person.
but not the actual person that's sitting in front of you and not their psyche and not their emotions. You don't
Right.
really think about all that. You know, cancer doesn't only change your physical aspect, but it does a number on your psychological aspect. And that's what you carry more is your psychological aspect as opposed to your physical aspect. Because yeah, the skin will go back to normal. You'll treat it, you'll take care of it. But what happens to your psychological perspective on cancer? The fear is always there,
Mhm.
you know. You're afraid to go anywhere because of infection control. You look at everything. Manicures and pedicures are out of the question, okay? Because
Mhm.
infection control is limited. I mean, I don't even go to restaurants to eat because I don't know if they're talking over my food, if there's germs. So
Mhm.
this is a lifelong situation. So
Right.
this is why I decided to educate the public as much as possible. And as you know, I'm a cancer advocate. I go to various colleges and hospitals and speak to people about oncology aesthetics. And funny enough, I went and gave a talk last week at one of our biggest colleges here in Ontario. And the teacher herself told me that they don't even mention the word cancer. She says they refer to it as the C word. And I'm thinking, what?
Oh.
Yeah.
So as now let's look at this on the perspective of someone yourself
Yeah.
in the industry, and you've battled through it, and that's amazing. How do you feel about that as a person? Not using the word cancer. Like, we shouldn't use that word?
I feel like what like as if we've got a plague. We're like we're not allowed to even touch people. I mean, that's the way I'm looking. I'm thinking, are you kidding me? Like it's not our fault that we got cancer. It's not something
So
that we,
yeah,
you know,
of course, of
and
course. So if
they
you
do this.
have somebody, like, how would you, just a couple little tidbits of, I'm the esthetician, and someone walks in as a client first time. I discover through the form we're doing
Yes,
that
yes,
she's a cancer patient.
yes.
What should be the professional's initial response to that? What would
Yes.
you, a couple simple guidelines? I know there's training and everything, but what's a couple things just to, so they can understand, oh my God, I don't want to hurt her.
Yeah.
Absolutely. You have the compassion, empathy. and that's your
Yes, yes,
professionalism to hopefully not do that. But what do you
yes.
think to make sure that you as the client is comfortable?
Well, first of all, you don't tell the person that's had cancer, I'm sorry that you have cancer. That's something that we don't want to hear at all. What
So
we
what do
could
you
say,
suggest?
what I do suggest is, thank you for being here. What could I possibly do to make you feel more comfortable? How would you like me to touch you? How would you like me to, you know, perform the service? You guide me. That's what I would say.
Yeah,
Because
because everyone's different, right? When it comes to the
everyone is different.
responses of their treatments.
Some people don't like to
I
be touched a certain way.
was gonna say, yeah,
Some
sometimes it's
people do
sensitive. Yeah.
for religious reasons,
Yeah.
for,
Or
whatever.
emotional, like you said, the emotional touch.
Yes, some
Yeah.
people don't like to be looked at. Some people don't want to remove their brassiere. Some people don't want to get undressed. So you have to be very, very sensitive to the person that's in front of you.
And
You
that's
kind of
basically listening to what they're telling you.
you must learn to listen and be compassionate and humble.
And not, oh, I would imagine you don't want to overdo this. Is this okay? Are you okay with that? What about this? And that, like, you don't want to go
Yeah, no, you
overboard,
don't. No, you
right?
don't, because then that's going to be a negative as opposed to a positive.
Yeah. Hmm.
Uh, Everything has to be in balance.
Hmm.
While they're undressing, you give them their privacy. If they don't want to undress, that's okay too. And things like that. It's all in the wording.
Yeah.
And you don't want to look at them in shock or in disgust. You want to
Yeah.
look at them with compassion, with
Hmm.
feeling. You don't
Hmm.
necessarily know what they're going through,
Right.
okay, because you can never imagine what they're going through, but you could be attuned to that. You could be
Mhm.
receptive to that.
Well, and sometimes I can only imagine that, in the morning of your treatment, you're going to go visit, have your service done. On the way there, everything's great. And then once you're in the room, it could, because the emotions are there, right? It
Yeah,
can
they
change.
they
It can
are.
change. It could even change during. Did that ever happen to you in the middle of a service? You could feel things change? No,
No,
you were pretty good.
I was fortunate enough to stay positive. I was, and I did, and I thank my faith for that, and I relied a lot of it on my faith, and it worked. Yes, there were days where I was, off the grid.
Of
I
course.
didn't want to deal with anyone, because it does affect you. No matter how strong you are emotionally, it does
Mhm.
affect you. There were days where I couldn't even get out of bed. There were very, very few out of the
Mhm.
whole year. I might have had two or three of those days, but
Mhm.
nevertheless, I had them. And that's pretty much the way it is. So those things you have to consider all the time.
Mhm. So, you ended up noticing the gap, and like I said, there are people out there that are, I'll say, trained in it, but there's a lot that are not. So that led you into your creation of OncoOne Aesthetics. And
Yeah.
could you tell us, how did that begin?
Okay.
And for those
That
that are
began
wondering, why don't you just explain what it is first, and then,
Onco.
yeah.
Yes. OncoOne, is a school that is basic basically teaching oncology aesthetics, and it caters only with cancer patients. Now, you did say that there are other schools here that offer oncology course, but it's not from a survivor-led oncology aesthetic school, which is totally, totally different. It's like, I'll give you for instance, oncology doctors know what's written in a book. They don't necessarily know what the patient is going through, because I had my oncologist ask me certain things. Marilyn, how do you feel? How does this feel? How does that feel? Our books, we read about it, but we don't really know the experience. And same with my oncology school. I lived it. I know it.
Mhm.
I've been a medical esthetician for 25 years, so I know both sides of the coin. So this is where my oncology aesthetic school is different.
And
I
this is what's the background needed? Would you suggest before someone looked at going to take on an oncology program
well,
or aesthetics, I should say?
they need aesthetics. They
Okay.
need aesthetics for sure. There are prerequisites that you need to have in order to take my course because it is intense.
Mm-hmm.
It's a 40-week intense course.
Mm-hmm.
And I should say, sorry, 40-hour intense course.
Mm-hmm.
So you
Which is
need,
broken up, I think, over the weeks and stuff. We'll have
yes,
your
yes,
contact information in the show notes if they want to know a little
yes,
more details.
yes,
But the basically like when you look at the role or the skill and the safety, you also mentioned the soul of the practitioner.
yes.
And so can you maybe dive a little deeper into that? What does that mean? You kind of touched on it before, but what does it mean when you think, okay, there's going to be skill, yes, the safety, more than likely, yes, but when you speak of the soul of it, what are you referring to?
You have to have a lot of passion because you are dealing with broken women or men even. We're
Mm-hmm.
broken. We're broken. We may not be broken forever, but during our treatments, we are broken people.
Mm-hmm. Well, till you build yourself back, right?
Until we build ourselves. Some of us never do.
Yeah, that's fair, right? It's true.
Some of
So
us never do.
what do you think professionals often misunderstand, like our estheticians? What do you think is misunderstood or could
Uh,
be?
what is misunderstood is the physical and the emotional well-being of the client. I call them patients, but the
Yeah,
client.
yeah. For us, you're going to be a client, right?
Yeah,
Yeah.
that's what I really feel. The yes, adapting to the compassionate side
Mm-hmm.
of the person. It's not enough you know how to do a facial. It's not enough.
Mm-hmm.
Okay, anybody can do a facial.
I guess you could kind of call it the bedside manners,
Yes, it's what
right?
you can do. It's
Mm-hmm.
not you're not just doing a facial. You are creating something for them. You are rebuilding something for them.
Mm-hmm. That probably leads into the next part that I wanted to touch on with you is that what trauma informed care means. That's kind of what we're meaning here, right?
Rebuilding. You are
Rebuilding.
rebuilding. You are rebuilding them from the outside in.
So that's that emotional awareness of your client.
Yes, you need to have a lot of emotional awareness.
Mm-hmm.
You must. It's a must if you are dealing with oncology
Mm-hmm.
patients. It's not you're not a regular client.
Right.
You know,
Mm-hmm.
you're above that. So
And as
the
an esthetician,
esthetician,
we would want you to be a regular client. So if we're
yeah, it's not.
creating that safe, respectful, compassionate client experience, the bedside manners will say that, I guess. That will help, I think, to touch in a little bit more and to try to remove the fear. I think is the other side
Yes,
of this for estheticians
yes,
is we're brought on like, oh, you can't do that. Like they're
yes.
cancer patients. You don't know
Yeah,
what
yeah.
medications
You're
will
going to
do
hurt
what.
them, and then you're going to run into all sorts of problems. So they're already fearful, and when they
Mhm.
see us, they kind of go into they build this cocoon, and they don't come out of it because they're afraid. And this is
Mhm.
why I decided to do this because the gap is tremendous, and cancer has been out forever.
Mhm.
And I could understand why we still had this big, huge gap in aesthetics,
Mhm.
in every aspect of aesthetics.
Mhm. It's probably in a lot of places, but
A lot,
we'll just talk about the aesthetics world here.
it's
Mhm.
unbelievable. It's
And
mind
after meeting with you and chatting, which I'm thankful you reached out. That was great because it's led us to many conversations, and that's why I wanted to bring you on here, just to help bring awareness to everyone
yes,
in this profession. And I mean, oncology aesthetics, it's got to be the next thing that's going to be evolving. And I know I think the biggest thing that I can take from hearing you is really do your research on what it is that you're trying to learn and what will you gain from this before you
Yes.
sign up for a program. Because I'm not going to say that, one is, worse than the other. I mean, it's like finding an aesthetics program. Like there's so many out there,
Yeah, they're all
right?
cookie
So
cutter.
it's
They're
really
all cookie
looking at
cutter.
it. Mhm.
I've looked at all of the curriculums, and they're all the same because they all follow a certain curriculum. So that brings me to the fact that I had to write my own curriculum.
And that's where I was trying to lead to. That's good.
Okay.
You
I
did. How long did you spend writing your own? And you didn't do it like like you did it on your own, but you also involved a few professionals as well, right? You asked questions with the
Yes, of course.
oncologist and
Yes, my oncologist, my plastic surgeon, and my team of nurses at the hospital. It took a good, I would probably say, 8 months. You know, I had put all this information together because I mean, what do you do when you're sitting, on a bed or on a chair for 5 hours, getting chemo injected into your body? What do? To distract yourself. I would, make notes. I would write. I also wrote a cancer survivor cookbook because I'm also a certified nutritionist. So I did that as well. That's out of the market. That's been on the market since December.
lovely.
And
Hmm.
yeah, and then the book came because I was looking to to find to find a textbook that would, help these girls when they needed to learn for oncology, and I couldn't find any. There was one, but it was totally outdated. And I'm
Mm,
thinking, this is it?
mhm,
There's one and it's outdated
mhm.
by 20 years? Like things have changed since then.
It sure has.
Like
And it's going to keep changing,
things
it's
change
going to keep
every week. I get, newsletters every week with new info. Like the one, 2 out of 5 people now in Canada get cancer. Last year it was 1 out of 5. Now it's 2 out of 5.
yeah.
Like, what's going on out there?
Mhm.
And so things
What
evolve, and education evolves as well. And
Mhm,
unfortunately, it doesn't evolve enough when it comes to oncology aesthetics. But here
mhm.
I am. I'm going to make it so that it does.
You're out there. I know you run workshops and things like that
I
too, but
do. I do. I do.
we'll put all the information in the description as I mentioned. And so your vision for the future oncology esthetician, what do you hope students carry forward into the practice?
That
Into
they
the future?
learn, that they're passionate, that they're going to be trailblazers. They're going to be, I mean, professionals in their field. They're going to be oncology aesthetics practitioners, and that's a big shoe to fill.
Mhm.
And if you're not passionate enough, I don't think that the job is for you. You have to have a lot of passion because you need a lot of tender, loving care. Cancer patients can be difficult as well.
Mm, that's
So,
fair.
and yeah, because half of the time we don't know what's going on. We're like a fish out of water, and so we need that extra tender touch. You can offer them a hug. You can offer them, you can hold their hand. You could, whatever you feel that's going to make them feel more comfortable and more at ease while you're giving them their treatment. You do it.
Mhm.
You do it with
I
permission,
know
of course.
in your training too, I believe you mentioned that you actually have for part of the practicum is that they are working with cancer patients.
Yes, they
So
do. They
they do
must
get the
bring this up.
experience on that, which is
Yep.
amazing. Now I know you're in Toronto and it's a physical actual location in Toronto. I
Yes.
know your hope is to expand that and
Yes,
across
I am.
Canada, which I think is amazing.
Yes.
But you're also holding like workshops and things like that.
Yes.
Lots of guest speaking, which is amazing. And
Yes.
I know you and I talked. I want to get you into one for us out here on this side of Canada.
I would love to.
Yeah.
Yes.
And we'll
Yes.
figure out that part in the future. I hope. I think it'd be great to have that awareness that you're trying to really push forward, the ambassador of healing right?
Yes.
It's the
Yes,
huge,
absolutely.
huge part.
Yes.
Excellent. So on that note, one word that represents your mission.
There are several, but
Okay, sure. We'll take a several. Go ahead.
um, as I said, restoration, because it's not just that's the word that comes to mind the most, is because you're not only restoring their physical, but you're restoring their emotional, you're restoring their spiritual, and you're restoring the industry.
Hmm.
We're also restoring the industry, which that is the biggest thing.
And I know as listeners can hear how passionate you are of this, but what continues to inspire you?
The fact that there's so many cancer patients out there that are being diagnosed every single day. I went to Humber River. They had a cancer signing between hospitals, so they emerged, and they asked me to go to give a talk, as I usually do, and they walked me through the cancer department, which I had just been a part of a year before. And do you know that when I walked in there and I saw those, it was full. There must have been 100 people sitting there. They were all looking and so sad, and I started to cry. I'm thinking, oh my gosh, a year ago I was one of these people,
Yeah.
and I have forgotten what it was like. I can't forget. I
Hmm.
can't forget that. So, and this is why I'm doing this, because I cannot forget them. I cannot forget that they're being left behind, and this will continue even after I'm not here anymore. And this is the whole idea behind this legacy of mine. It needs to continue.
I love that.
Yeah.
Well, I think that's a great way to end this segment. Marilyn, thank you so much for sharing your time, your story, and your heart.
Thank you.
And thanks everyone for tuning into Beauty Babble. And until next time.